So thanks for joining me, Catherine. Could you just talk me through what a holistic needs assessment is?
Yes, certainly. So a holistic needs assessment, or a HNA, put simply, is just a conversation between a patient and a healthcare provider or professional that allows the patient to express their needs, whether they're physical, psychological, social, spiritual, emotional, anything. And the reason we do them is we know that patients with cancer have unmet needs, and the needs can be wide ranging. The research also shows us that if we don't address those needs, then for those patients, they end up with poorer health and wellbeing outcomes. They can have a reduced quality of life, and it often leads to increased use of health and social care services. So therefore, the NHS plan recommended that all patients with cancer have a personalised care intervention where possible. And a HNA is a personalised care intervention. So it usually consists firstly of the patient completing a form, either online or as a paper form, in which they complete a checklist and tell us what their concerns are or their worries, and they rank those from things they're more worried about or that's top of the list and things that are lower down. The use of a form or a checklist isn't mandated in any way, but it can be useful, especially if it's been completed in advance by the patient and you've seen it, because it prepares both of you for that conversation and it acts as a guide through the conversation as well. So healthcare professionals use the self-identified worries and concerns to guide the conversation, and then they provide support and advice about those worries and concerns. They can often signpost to other services that might be helping patients with those challenges as well. The conversation is obviously always documented, and that's in a form of personalised care and support plan, a PCSP. And in addition to being put in the patient healthcare records, a copy is given to the patient themselves and a copy is sent to the GP. That provides the patient with something they can refer back to, which is really useful for those referrals. You might have put helpful phone numbers on, websites you think they might find useful. And in terms of when we undertake HNAs with patients, the Cheshire and Merseyside Cancer Alliance recommend that we do them for all patients no more than 6 weeks after diagnosis. And then again at the end of a patient's initial treatment, if you've got a patient just kind of having one treatment and then a big break. They also advise we do them at any other significant time, and obviously significant can be interpreted, but if the patient thinks it's significant or you as the healthcare provider think it's significant, then we do it then. So for example, in my trust, patients coming in through A&E for anything related to their cancer treatments get a HNA.
Okay. So could you talk me through the benefits of holistic needs assessments?
Yeah, definitely. So benefits to the patient are, firstly, by asking them to identify their own concerns, it provides a sense of ownership, not only of the disease, but also of the HNA. And it almost lets the patient know that they're permitted to talk about anything. So, for example, patients might think they can't discuss financial worries in a hospital because we're here only for the physical, and obviously that's not the case. The HNA really looks at the whole person and not just physical side effects. It's kind of been described as therapeutic in and of itself. But by receiving advice or help for worries, then we hope that that will alleviate those for patients, even if it can't remove them completely. And the signposting element to the HNA, which can be massive, informs the patient of support that is available to them out there in their community, which might be more accessible, or just not being in a hospital setting might be preferable to them. HNAs are also useful to us as healthcare providers, because by learning what our patients are really worried about, what their particular concerns are, we get a more rounded picture of them as an individual. It can also give us good feedback on those other services we signpost to, because obviously you'll follow up with patients, ask them if they made contact, ask them how they found that service.
Okay. So it sounds like a holistic needs assessment would be a really great tool for a treatable but not curable cancer patient to have. Is that right?
That's absolutely right, yeah, Laura. So we know that TBNC patients face quite a long and complicated pathway. It often involves multiple treatments. They're having repeated scans or procedures. So not surprisingly, actually, research that Macmillan have undertaken do tell us that TBNC patients often need lots more support, whether that's financial, emotional, physical, everything. And I know that your project that you've worked on found TBNC patients often need more detailed information compared to people living with primary cancers, definitely surrounding things like prognosis, certainly how to keep track of multiple appointments that can be across different hospitals. They're often more likely to be interested in taking part in clinical trials, and therefore it's really important that patients with TBNC are offered the HNA, because that conversation and that voicing of worries, plus the creation of the personalised care and support plan, because of their more complex conversation, can actually have extra value to them as individuals.
Okay, that's brilliant. Thank you, Catherine.